Okay. So today we're going deep on something pretty major. Social influence and group behavior. Especially for those of you out there like knee-deep in MCAT prep.
Right.
This is going to be huge for the psych and sociology section,
Absolutely.
Behavior in groups, social norms, deviance, like all that good stuff.
This is core stuff.
Yeah, for sure.
And, think about it, even beyond the MCAT.
Right.
This is about, your future as a doctor. You're going to be dealing with patients, their families, colleagues, working in healthcare teams.
All the time.
This is about understanding those social dynamics to be like a more effective and insightful doctor.
Yeah. Imagine trying to figure out why a patient isn't following your advice because of what their friends or family believe.
Exactly.
Or what's going on in a high-pressure situation with your team in the hospital.
Yeah, you got to get this stuff.
This is like real-world stuff you're going to use every day.
Real world for sure.
Okay, so let's just dive right in. How about we start with, how being around other people can affect us?
So let's start with something called social facilitation.
Okay.
You know that feeling when you're practicing something?
Yeah.
And you suddenly get better when somebody walks in the room?
Oh, yeah, totally.
Like if you're a future surgeon, you're practicing your surgical knots and someone walks in and suddenly...
You get that little boost, right?
Oh, yeah.
Yeah, it's like when I'm trying to nail a tricky recipe and someone's watching me, I tend to pay more attention to each step, and it usually comes out better.
Yeah.
So just having others around can make us better at stuff we've already got down.
That's it. That's social facilitation in a nutshell.
Okay, so what about the opposite?
Okay, so let's flip the script and talk about Deindividuation.
Deindividuation.
This is where being in a group can actually loosen up your sense of self and responsibility.
Oh, interesting.
Think about being in a massive crowd at a concert or a sporting event.
You kind of lose yourself in the crowd, right?
Exactly. You feel anonymous.
So how does that change how we act?
Well, in those situations, people might do things they wouldn't even think about doing if they're alone and easily identifiable.
Right, because they feel anonymous.
Exactly. That anonymity lowers your inhibitions.
Makes you feel less accountable.
Totally. It's a big part of understanding how crowds behave.
So is that connected to the bystander effect, then?
Oh, absolutely.
The idea that if there are tons of people around during an emergency, you're less likely to help.
It's a classic example and kind of a troubling one.
Yeah. Why is that?
Basically, the responsibility gets spread out so thin.
Right.
When there are lots of people around, everyone feels less personally obligated to act.
Because they assume someone else will do it.
Exactly. And so, weirdly enough, having more potential helpers can actually mean nobody helps.
So counterintuitive, right?
It is.
You'd think more people would equal more help.
Yeah, you think so?
Is it maybe people assume someone more qualified is going to step in?
I mean, that can play a part, but the core of it is that diminished sense of individual responsibility.
It's not necessarily a conscious choice not to help. It's like a psychological thing that happens because of the presence of others.
Wow. Okay, so that's de-individuation and the bystander effect.
Now, there's another related concept called social loafing.
Social loafing. Okay.
And this one's a bit different. Instead of inaction in an emergency, it's about reduced effort in a group task.
Oh, so like that classic group project scenario.
Exactly.
Where some people coast because they think others will do the work.
Precisely, when individual contributions aren't easily identifiable in a group effort, some people put in less effort than they would if they were working solo.
They're loafing.
They're loafing because they figure their lack of effort won't really affect the outcome or be noticed.
Sneaky.
It happens.
Okay, so we've seen how just the presence of other people can subtly change our behavior.
Right.
Sometimes for the better, like with social facilitation.
Right.
And sometimes it leads to less personal responsibility, like with de-individuation and social loafing.
Now let's move on to some more direct ways that people influence us.
Okay.
Like peer pressure.
Peer pressure. Oh yeah, we've all been there.
For sure.
It's the influence our peers have on us to behave in certain ways.
Our peers being people our own age or with similar status.
Right, similar social standing.
Okay.
This could be really direct, like with explicit encouragement or demands.
Yeah.
Or it could be more indirect, like unspoken pressure to fit in with the group's norms and expectations.
And that need to fit in is a big part of conformity, right?
Absolutely, conformity is super powerful.
Where we adjust our behavior to align with the group.
Yeah, and it happens for different reasons. There's normative conformity, which is when we change our behavior to be accepted and liked by the group.
Even if we don't actually agree.
Even if we secretly disagree.
We just don't want to stand out.
We want to avoid being judged or rejected.
Right.
Then there's informational conformity, and that's when we genuinely believe that others in the group know more than we do.
Especially when things are unclear.
Exactly. In ambiguous situations, we look to the group for guidance on how to act.
So normative is about fitting in, and informational is about actually trying to figure out the right way to do things.
That's the distinction.
Makes sense.
Now, another major form of social influence is obedience.
Obedience.
Following the instructions of an authority figure.
Okay.
And this takes us to Stanley Milgram's famous experiments.
Oh, yeah.
His research, although ethically controversial, was really powerful in showing how far people would go to obey orders from an authority figure.
Even when it meant hurting someone else.
Even when it went against their own judgment.
It's crazy how strong the influence of authority can be.
It really is.
Okay, so we've talked about how individuals are influenced in groups. But what about when those groups have to make decisions together?
Right.
Is the outcome just the sum of what everyone wants individually?
Not necessarily. Group decision-making has its own quirks.
Okay, tell me more.
Two key things to keep in mind are group polarization and groupthink.
Group polarization and groupthink.
Let's start with polarization.
Okay.
This is the tendency for discussions to make the group's initial opinions even stronger.
So if the group is leaning towards a certain view,
Right.
talking about it just pushes them further in that direction?
Exactly. It's like a moderate opinion becomes a strong conviction after they've all had their say.
Interesting.
The discussion exposes people to more arguments that support their initial views, and that strengthens those views.
Okay, I get it.
Now, groupthink is different and potentially more problematic.
How so?
It's all about this desire for harmony and consensus.
Okay.
And that can actually override a realistic and critical evaluation of different options.
So basically, they avoid rocking the boat even if it means ignoring potential problems.
Precisely, in groupthink situations, members might not speak up even if they have doubts.
Because they don't want to disrupt the harmony.
Exactly. And there could be this illusion of unanimity where everyone thinks everyone else agrees because nobody's objecting.
But they might all have secret reservations.
They might.
And this lack of critical thinking can lead to some seriously bad decisions.
You can think about historical examples where groups made terrible choices even though some members had concerns.
Yeah, you can see how group dynamics can really backfire.
They can.
Okay, so we've looked at how groups influence individuals and how they make decisions.
Right.
Now let's zoom out even further and talk about the broader rules that guide behavior in society.
These social norms.
Social norms.
These are the unwritten rules of what's considered acceptable and appropriate.
In a given society or group.
Right. And they're shaped by culture, history, and the specific situation.
Okay, so these norms aren't all equal, right? Like some are more important than others.
There are different levels, like folkways, mores, and taboos.
Folkways, mores, and taboos.
So folkways are the minor everyday norms often related to etiquette and politeness.
Like saying please and thank you.
Exactly. Or expectations about how to dress in certain settings.
Okay.
Violating a folkway might get you a disapproving look.
Right.
But that's about it.
What about mores?
Mores carry more weight. They have moral significance.
Okay.
Breaking a more can lead to serious social disapproval or even legal penalties.
So something like laws against theft.
Exactly. That's a good example. Those laws reflect a deep moral belief about property rights.
Makes sense.
And then you have taboos, which are the strongest and most deeply ingrained social norms.
Like the untouchables.
Exactly. They're so strongly forbidden that even thinking about them can cause revulsion.
So what are some examples?
Well, incest and cannibalism are often cited as taboos.
Right. Those are pretty universally condemned.
They are virtually unthinkable in most societies.
Okay, so folkways are like customs, mores are moral rules, and taboos are like the ultimate no-nos.
You got it.
What happens when these social norms break down?
That's when you get anomie.
Amy.
It's a state of normlessness or social disorder.
Okay.
It often happens during times of rapid change or upheaval.
When the usual rules don't apply anymore.
Exactly. People feel lost and confused without clear guidelines for how to act.
And that can lead to instability.
It can.
And when people break these norms, whether the norms are strong or weak, that's deviance, right?
Exactly. Deviance is any behavior that goes against the accepted norms.
And that can range from minor infractions to serious crimes.
Right. It's a whole spectrum.
Are there any theories about why deviance happens?
There are a few prominent ones. Differential association theory suggests that people learn deviant behavior from others who engage in it.
So it's like a learned behavior.
In a way, yeah. Then there's labeling theory, which focuses on how society's reaction to certain behaviors can actually contribute to more deviance.
So being labeled as a deviant can make someone more likely to continue that behavior.
Exactly. It can become a self-fulfilling prophecy.
That's heavy.
It is.
Now, you mentioned mass hysteria before.
Oh, yeah.
How does that fit in with all this talk about social influence?
Mass hysteria is a great example of how social influence can play out on a huge scale.
Okay.
It's the rapid spread of anxieties, beliefs, and behaviors through a group, often without a clear physical cause.
So like a collective freakout.
Kind of think about historical panics like the fear of witches,
Right.
or even more recent examples of widespread concern about a health issue that turns out to be mostly psychological.
It's like a wave of emotion that sweeps through a group.
Exactly. The power of suggestion and social contagion is at play.
Wow, we've covered so much ground today.
We have.
Let's do a quick recap for our listeners, especially those getting ready for the MCAT.
Sure.
We started with social facilitation.
How being around others can affect performance.
Then we talked about deindividuation.
And how it can lead to things like the bystander effect.
We also discussed social loafing.
Reduced effort in group tasks.
Then we moved on to peer pressure.
And the different types of conformity.
Normative and informational.
Right.
We examined obedience to authority.
Illustrated by Milgram's work.
Then we got into group dynamics.
Group polarization and the dangers of groupthink.
And finally, we talked about social norms.
From folkways to mores to taboos.
And touched on anime deviance and mass hysteria.
A lot of ground covered.
All essential concepts for the MCAT, but also for understanding the human side of medicine.
Absolutely.
So thank you so much for breaking all this down for us.
It's been my pleasure.
And to all our listeners out there, thanks for joining us for this deep dive into social influence and group behavior.
On the Psych Pulse playlist.
In our next episode, we'll be talking about socialization and the role of agents.
How we learn the norms and behaviors we've been discussing.
We'll be exploring the key individuals and institutions that shape our understanding of the social world.
Should be fascinating.
Now, here's a final thought for you to consider as you continue your MCAT prep and your journey towards becoming a doctor.
Okay.
How can a deep understanding of social influence and group behavior help you not just on the exam, but also when interacting with patients from all walks of life?
That's a good question.
And how can it help you navigate the complex social world of healthcare?
Lots to think about.
Definitely something to reflect on. Until our next deep dive, keep exploring.
Keep learning.
And good luck with the MCAT.
You got this.